Hello, everyone. Today we are going to discuss an important topic in anesthesia, preoperative assessment and pre-medication. Before giving anesthesia, the anesthesiologist must carefully evaluate the patient. This process is called preoperative assessment. The aim is to understand the patient's health condition, identify risks, and prepare the patient safely for surgery. Then say, in this video, we will discuss goals of preoperative assessment, history and physical examination, investigations, risk stratification, ASA classification, preoperative instructions, pre-medication. Definition: preoperative assessment is the evaluation of a patient before surgery to determine fitness for anesthesia and surgery. It includes history taking, physical examination, investigations, risk assessment, and giving preoperative instructions. Goals of preoperative assessment. The goals of preoperative assessment are to reduce patient anxiety and educate the patient about anesthesia, to obtain information about the patient's medical history, to perform a thorough physical examination, to determine which investigations are required, to plan the appropriate anesthesia technique, to obtain informed consent, and finally, to give important preoperative instructions. Physical examination. Next step is physical examination. The doctor checks pulse rate, blood pressure, respiratory system, heart function, nervous system. One of the most important parts is airway assessment. This helps the anesthesiologist predict whether intubation will be easy or difficult. Airway assessment, very important. Airway assessment helps the anesthesiologist predict difficult intubation. Important parameters include mouth opening. Normal mouth opening is more than 3 fingers breadth. Reduced mouth opening may make intubation difficult. Malampati classification. This classification assesses visibility of structures in the mouth. Class 1, full visibility of tonsils, uvula, and soft palate. Class 2, partial visibility of uvula. Class 3, only base of uvula visible. Class 4, only hard palate visible. Class 3 and Class 4 suggest difficult airway. Thyromental distance. Normal. Thyromental distance is more than 6.5 centimeters. Short distance indicates possible difficult intubation. Neck movement. Normal neck flexion and extension should be adequate. Restricted neck movement may make laryngoscopy difficult. Systemic examination 1. Cardiovascular system. The doctor listens to the heart using a stethoscope. They check for heart rate, heart rhythm, presence of murmurs. Abnormal findings may indicate heart disease. 2. Respiratory system. The doctor examines the lungs. They check for normal breath sounds, wheezing, crackles. Abnormal sounds may indicate asthma, infection, or lung disease. 3. Nervous system. The doctor checks the patient's level of consciousness and neurological status. This is important especially for patients undergoing regional anesthesia. 4. Abdomen and spine. Abdomen is examined for organ enlargement, pain, or masses. Spine examination is important if spinal or epidural anesthesia is planned. Breath holding test, simple respiratory assessment. The patient is asked to take a deep breath and hold it. Normal breath holding time is more than 25 seconds. 15 to 25 seconds is borderline. Less than 15 seconds suggests poor cardiopulmonary reserve. Next one is investigations. Not all patients need many tests. Investigations are done based on patient condition and type of surgery. Common investigations include complete blood count, blood sugar test, renal function test, liver function test, urine analysis. Some patients may also need ECG or chest X-ray. The most important that we do in pre-op assessment is ASA classification. To understand surgical risk, patients are classified using ASA grading. ASA 1, healthy patient. ASA 2, patient with mild disease. ASA 3, patient with severe disease. ASA 4, severe disease that is life-threatening. ASA 5, very critical patient who may not survive without surgery. ASA 6, brain-dead patient for organ donation. Higher ASA grade means higher surgical risk. Next one is what are the instructions to be given during preoperative assessment? Preoperative instructions. Before surgery, patients must follow some instructions. Fasting is very important. Solid food should be stopped 8 hours before surgery. Clear liquids like water can be taken up to 2 hours before surgery. Patients should also remove dentures, contact lenses, jewelry, nail polish. The next topic is very important, which is pre-medications. What is pre-medication? Pre-medication means medicines given before anesthesia. These medicines help prepare the patient for surgery. Let's see the goals of pre-medication. Pre-medication is given to reduce anxiety, produce mild sedation, provide pain relief, reduce secretions, prevent aspiration, prevent nausea and vomiting. Common pre-medication drugs. Some commonly used drugs include midazolam, used to reduce anxiety and produce sedation, atropine or glycopyrrolate, used to reduce secretions, ondansetron, used to prevent nausea and vomiting, metoclopramide, used to reduce aspiration risk. Finally, discussion. Let's discuss the points together. Preoperative assessment helps evaluate the patient's overall health before surgery. It includes history taking, physical examination, and necessary investigations. This assessment helps identify possible risk factors and plan safe anesthesia. Premedication is given to reduce anxiety, provide sedation, and decrease secretions. It also helps prevent complications such as aspiration and postoperative nausea and vomiting. Therefore, proper preoperative assessment and premedication are essential for safe anesthesia and better surgical outcomes. Thank you for watching. This is Soumya Thangaraj from Instant Notes. See you again in the next video with another interesting topic.